Picture this. You're sitting in a crowded, noisy coffee shop. The espresso machine is hissing away. Chairs are scraping loudly across the floor, and there are, I don't know, a dozen different conversations happening all around you at the exact same time. It's loud, it's chaotic, and your brain just can't quite filter any of it out. Now imagine you literally can't get up and leave that coffee shop. That intense, completely overwhelming sensory overload is just locked inside your mind 24 hours a day. Welcome to today's Explainer, where we're going to take a calm, empathetic look at the clinical realities of a condition that is so deeply misunderstood.
So, let's stick with that coffee shop analogy for a second. Imagine that right in the middle of all that clatter, you clearly hear someone whispering your name. Then, a radio starts blaring a warning, speaking directly to you. But here is the terrifying catch. You're actually sitting completely alone in a perfectly quiet room. The noise, the voices, the warnings, they are entirely inside your mind. For someone experiencing the symptoms of schizophrenia, this isn't just some creative metaphor. It's their reality. It's an overwhelming internal noise that makes just getting through a normal Tuesday incredibly difficult.
All right, let's just clear the air right out of the gate. The word schizophrenia comes from Latin, and it roughly translates to split mind. But honestly, that origin has led to a massive Hollywood misconception. Having schizophrenia does not mean having a split personality or multiple personalities. That is a completely different, exceedingly rare condition. Schizophrenia is actually a chronic brain disorder. And just to put things into perspective, it affects less than 1% of the US population. Most folks living with this condition are no more dangerous than you or me. Actually, they're much more likely to be vulnerable and in need of our support.
Section 1. The reality of schizophrenia. Let's break down some of that clinical jargon. Okay, so if it isn't a split personality, what exactly is the medical reality here? Well, to really understand it, we need to look at one core concept, and that's psychosis. Psychosis is, essentially, a set of symptoms where a person loses touch with reality. It happens because there's a glitch, a disruption, in the way their brain is processing information. To put it simply, a person's thoughts and perceptions get so tangled up that it becomes nearly impossible for them to tell what's actually happening out in the real world versus the unreal experiences being generated by their own brain.
Section 2. Positive and negative symptoms. What is added and what is lost.
When someone loses touch with reality, the symptoms can show up in a few different ways. In the psychiatric world, doctors basically categorize them into two distinct buckets, positive and negative. Now hold on, positive and negative here do not mean good and bad. Think of it more like math. A positive symptom is something the illness adds to a person's reality, something that's abnormally present. A negative symptom, on the other hand, is something the illness subtracts or takes away, something abnormally absent from their daily functioning, like suddenly losing the ability to show any emotion.
Let's look a little closer at the positive symptoms first. These are the additions to reality. We're talking about hallucinations, like hearing voices or seeing things that aren't actually there. It also includes delusions, which are these intensely strong false beliefs or extreme paranoia. It can even show up as really disorganized, jumbled speech. And here's something absolutely wild from the clinical data. If you look at brain scans of patients, the speech area of their brain actually lights up when they hear voices. The brain is reacting exactly as it would if someone were standing right next to them talking. That proves this experience is physically, terrifyingly real to them.
On the flip side, we have the negative symptoms, the subtractions. These include what doctors call a flat affect, which basically means the person appears completely emotionally blank. They might also experience avolition. That's a severe, crushing loss of motivation that leads to social withdrawal or even completely neglecting their basic personal hygiene. It is so crucial to talk about these because they are often the source of a lot of heartbreaking friction with family and friends. Loved ones might look at this and mistakenly think, oh, they're just being deliberately lazy or rude, when in reality, it's a devastating, very real part of a biological illness.
Section 3. The brain's volume dial. The role of dopamine.
So, to make sense of why these positive and negative symptoms happen, we have to look under the hood at what's physically going on inside the brain. And it all comes down to a chemical you've probably heard of, dopamine. Dopamine is a natural neurotransmitter. Think of it like your brain's internal messenger service. It helps your brain cells, your neurons, send and receive signals to each other. When this messenger system is running smoothly, your thoughts and perceptions flow exactly as they should. But in a brain dealing with schizophrenia, this communication network goes haywire.
I always like to think of dopamine like the volume dial on your car stereo. If you have overactive dopamine in certain parts of the brain, it's like someone grabbed that dial and cranked the volume way, way too high. The brain just gets flooded with signals, and that's what leads to those positive symptoms, the hallucinations and the delusions. Conversely, if you have too little dopamine in other parts of the brain, well, that's like draining the battery. The volume drops way too low, leading to those negative symptoms, like the total loss of motivation and emotion. And this is exactly why many of the medications used today are designed to specifically target and adjust this chemical volume dial, helping bring the brain back to a healthy balance.
Section 4. Recognizing the early signs, the prodromal phase in teens and young adults.
Okay, so understanding the mechanics is great, but knowing the timeline is just as important. Schizophrenia almost always rears its head for the first time in late teens or early 20s. And before a major crisis hits, there's usually something called the prodromal phase. This is the slow, gradual period where early, really subtle changes in behavior unfold over weeks or even months, long before an acute psychotic episode ever happens. And we really shouldn't look at this phase as some scary inevitability. Instead, it's a huge, incredibly valuable window for observation, compassion, and getting early support in place.
Let's map out how this usually builds. First, you have normal adolescence. And hey, as we all know, that is already a massive roller coaster of intense emotional ups and downs. But then, things might shift into that prodromal phase. You might start noticing intense social withdrawal, that flat emotional affect we talked about, or grades suddenly falling off a cliff. Finally, if it goes unaddressed, it can peak into an acute episode, which is where the full hallucinations or delusions actually emerge. You can see how incredibly easy it is for this prodromal phase to just be brushed off as typical teenage moodiness, everyday anxiety, or depression, right?
And because those early warning signs mimic so many other things, like anxiety, ADHD, or bipolar disorder, a comprehensive psychological evaluation is absolutely crucial. This isn't something we can just guess at. A professional evaluation, bringing in clinical interviews and getting the perspective of family and teachers, is required to untangle what is just standard teenage angst from the early rumblings of a real psychotic disorder. Getting this right paves the way for actually effective support.
Section 5. Treatment, Therapy, and Hope. A path to recovery and community support. And that brings us to the resolution, and honestly the good news. While schizophrenia is a chronic condition, it is highly manageable today. Modern care uses a whole multifaceted toolkit. First up, you have antipsychotic medicines, which are specifically designed to manage that dopamine volume dial we were talking about earlier. Next, there is cognitive behavioral therapy, or CBT, which does wonders to help patients cope with stress and untangle their thoughts. And finally, there are community mental health teams that offer day-to-day on-the-ground support. Because of this modern toolkit, the vast majority of people with schizophrenia live completely independently or with their families. We really have to shatter this outdated myth that patients always end up locked away in hospitals long-term or out on the streets. With the right care, that is simply not the norm anymore.
A lot of health systems use what's called a structured care program approach to make sure this support stays totally consistent. It basically breaks down into 4 really clear steps. First, a full assessment of the patient's health and social needs. Second, the creation of a totally tailored care plan. Third, the appointment of a key worker, usually a nurse or social worker, so the patient always has a friendly first point of contact. And finally, regular reviews to make absolutely sure the treatment is doing what it's supposed to do. It's essentially a massive, supportive safety net built around modern recovery.
Now look, of course there are going to be times when an acute crisis does occur. But even then, the modern protocol is deeply grounded in compassion. Crisis resolution teams, or CRTs, step in to provide support during those severe episodes, and their main goal? To treat individuals safely in the least restrictive environment possible. A lot of times this means treating the person right in the comfort of their own home or maybe a local community center, rather than just jumping straight to institutionalizing them in a hospital. The goal is always stability, keeping their dignity intact and getting them back to normal life as quickly as possible.
I actually want to read you a powerful quote straight from our psychiatric source material for this explainer. Treatment can help many people with schizophrenia lead highly productive and rewarding lives. That right there is the clinical consensus. Optimism isn't just some nice, warm, fuzzy thought here. It is a fundamental part of the medical reality of this condition. People can, and they absolutely do, get better.
Which leaves us with this final thought. Now that you actually understand the mechanics behind this, the volume dial of the mind, the positive and negative symptoms, that critical prodromal phase, how can we change our everyday conversations about schizophrenia from fear to empathy? Because when we finally replace all that Hollywood stigma with relatable, scientific understanding, we don't just become more informed, right? We actually become a vital part of the support system for the people who need it the most. Thank you so much for joining me on this explainer. Keep learning, keep questioning, and I will see you next time.